Good morning. I'm Kristen Williams, student with the Mississippi for Women's University, and today I will be presenting my presentation on mental health, a global problem following a global pandemic. I will allow my audience to introduce themselves.
Hi, I'm Natalie Basania. I'm one of the pediatric gastroenterologists.
And I'm Trip, a medical student.
Hey, I'm Jessica, the admin.
And I'm Vanessa, the medical assistant.
And I'm Liz. I'm an RN, and I will be recording.
Okay, so this morning, Liz, if you can dim the lights for me, we're going to discuss mental health, a global problem following a global pandemic. And we're going to be talking about the effect that COVID has had in all population, but we'll highlight our pediatric population in which we work with patients. Our objectives is going to be discussed what has been the impact of the COVID-19 pandemic on mental health issues. We will discuss how the COVID-19 pandemic has affected minors, adults, and the elderly. We'll identify ways technology has influenced mental health issues during the COVID-19 pandemic, and we're going to discuss ways we can improve our mental health during this COVID-19 pandemic. Let's talk. We're going to talk again about the mental health issues and the impact that COVID-19 has had on it. So COVID-19 effect on mental health. As we all can relate, COVID-19 has caused an increase in stress, increase in anxiety, depressive disorder, increase in eating disorder, and increase in alcohol or drug abuse. This can be related to in our adult populations. With the adult population has the responsibility of taking care of minors and elderly. This has created an issue with anxiety and depression, in that just the added stress with day-to-day activity, the added stress of being responsible for other people, and just the fear in itself of the unknown. The adults have increased in turning into food. That has been the comfort with isolation, just overeating, binge eating, or just the increase in alcohol or drugs, whether it's prescription drugs or recreational drugs. There has been an increase with the onset of the COVID-19 pandemic. COVID-19 affect minors. COVID-19 affect minors in the same way that it affect adults. It has caused an increase in stress. Their day-to-day activities, their educational patterns has been disrupted. They're used to being around their peers. They're used to that social interaction of people of their age, and that has caused an increase in depression. It's caused an increase in agitation. Just not being able to do their normal functions. So it has affected minors as well. I'm gonna ask Dr. Basanya to highlight in our pediatric patients that we see what has been some of the increase in symptoms that you can relate to in the pediatric population.
So I know in our pediatric GI clinic, when we're definitely seeing a lot of, given the anxiety and stress surrounding COVID, the unknown, as you mentioned, or potential of contracting it, an increase in abdominal pains and abdominal complaints such as irritable bowel syndrome. We've also seen patients who have had COVID-19 now coming in with abdominal pain, and that could be related to post-infectious gastritis, irritable bowel syndrome, or, can be the onset of another inflammatory or other illness of the GI tract. So we're seeing a number of complaints from a medical and mental health standpoint.
Okay. COVID-19 effect on the adults. As ourselves, that's our age group. And again, we're responsible for still working. We're responsible for making sure the minors have and what their need. And again, the added stress. We have had an increase in depression, and increase in anxiety as well. So COVID-19 affects all age group. About how we deal with each of these symptoms, it varies. It varies based on our age. It varies based on the resources we have, and it just varies from person to person. The elderly population are already, are very fearful, and they're the most ones that are overlooked. So this has caused them to have an increase in stress, depression, and anxiety, because the elderly, they are more prone to different things. The elderly most are on a fixed income. So with this pandemic, it's been a lot of pandemic purchasing. So that's been putting them at risk of not meeting their day-to-day needs. The fear of the unknown of COVID, their age and comorbidities have made them more prone, and just the fear of what the disease can do to them. The unknown of the availability of the vaccinations and just the resources to get them to and from. So, the elderly has been greatly impacted by the COVID as well. Ways that technology has impacted the COVID-19. Technology has actually, in my opinion, helped with the COVID-19 pandemic, because technology has allowed people to socialize. Being in isolation, people have used blogs, social media, emailing. It's been used as a way of socializing. It has been used as a way to communicate. It's allowed the opportunity for people to work remotely from home and still earn an income, as well as education opportunity for kids and college students to continue their education. Technology has allowed shopping. A lot of people, the fear of getting out, going into the stores, contracting the virus. It has allowed the opportunity to people to shop from the comfort of their home or the workplace and have it shipped to home. So COVID-19 technology has had a positive impact during this pandemic. How can we improve our mental health during COVID-19? The most important thing are to follow the recommendation of our local and federal government. We need to follow those recommendations. We need to make sure we get proper rest. We need to increase our physical activity. The more we do, the better we feel. We need to work on our eating habits. We need to eat a more balanced diet. Vitamins, increasing vitamins in our diet from our fruits and vegetables. That'll help build our immune system. And overall, having a positive attitude. Your attitude and the way you view things really can greatly affect outcome. So just being positive and being nice to one another, because we never know the amount of stress of what the next person's mindset is. So doing these things will greatly help improve all of our mental health during this pandemic. Thank you for your time.